Hello there, Dr. Suleiman here once again. I'm Chronic Pain GP, and today's video is about diagnosis in chronic pain conditions. So I often ask myself, what is the purpose of a diagnosis or diagnoses in chronic pain? In today's short video, I'm going to try and demystify the diagnosis process. For me, one of the most important phases of the consultation is the conveying of a diagnosis to the patient. It's my opinion that this crucial phase of the consultation can sometimes alter the trajectory of the future management of the patient and also how the patient feels about their diagnosis. The diagnosis can often provide validation to the patients that after all this time someone actually believes their symptoms. It's often quite a cathartic experience. Patients can get very emotional, and often there's a palpable relief when you convey the diagnosis to them. On the converse side, sometimes patients are quite skeptical and can express their frustration and anger, and this needs to be allowed as part of the consultation process. During the history-taking aspect of the consultation, I often use the acronym ICE, which stands for Ideas, Concerns and Expectations, as the basis of giving and advising on diagnoses. So these are some of the questions I often ask as part of the history-taking aspect, which can help me when conveying a diagnosis. These include questions such as, tell me about what you feel is causing your problems. I see you've done some research. What do you think is causing your problems? I then can ask directly about their concerns. What are your concerns? What is the worst thing you think it may be? These next few questions can then help guide me about future management with the patient. How do you feel I or we as a team can help you? What were you expecting would happen in today's consultation? Now, as an example of a diagnosis which I see lots of in my chronic pain clinics is fibromyalgia. In my opinion, I do feel that fibromyalgia is underdiagnosed both in males and females. Now, fibromyalgia is a complex syndrome which can cause upset and frustration not only for patients, their carers, their families, but also for general practitioners and specialists. I do feel it's a cross-cultural diagnosis and can manifest in different ways in different cultural groups. Sadly though, there is some miseducation and ignorance amongst clinicians about this condition, and some clinicians still do not believe it actually exists. I, for one, am doing my best to try and educate clinicians and patients and the general public about this complex condition. Now, I say it's complex because over the years I've seen hundreds if not thousands of patients with the condition, and I do feel it's probably hormonally related, or there could be an autoimmune component to this. However, research is still ongoing. Now, fibromyalgia often presents in primary care with the following symptoms. Usually there's chronic widespread pain. Chronic in this context means more than 3 months, and it's usually on different parts of the body. There did used to be the 11 out of 18 points, but the most recent guidelines in 2010 suggest it can be over different parts of the body. There's definitely an element of cognitive disturbance, and often patients and fibromyalgia patients do describe this as a fibrofug. Patients can often demonstrate word finding difficulties and concentration difficulties. Pretty much all the patients that I see often have an element of unrefreshing sleep patterns, and therefore they're often constantly tired during the day. The fourth part of this diagnostic criteria often is a combination of other symptoms such as bowel disturbance, migraines, bladder problems, rashes, tinnitus, and heartburn, amongst others. With so many different systems affected in fibromyalgia, it is clear that there must be a physiological process which can affect different bodily systems, such as a hormone or specific autoantibody. So in summary, the diagnosis can often be a communication platform between the clinician and the patient to try and move forward. It can also often be an open and honest discussion around what to expect moving forward. I do try my best to remain optimistic when giving the diagnosis to the patient, as often patients are crying out for a cure to their problems, and this is often not achievable in modern medicine. Now, my next video will be about reassurance in chronic pain conditions. and I'll specifically look at how I try and reassure patients with respect to their diagnosis and their future management options. So please try and join me in a week's time, and I'd just like to finish off by saying please remember to subscribe and like the video. Please leave feedback below, and I'll try and answer any comments, and thank you once again for your time.